They are including posterior, anterior, central. As I explained it for you, posterior one is including most of the dislocation is including kind of flexion, adduction, internal rotation. Flexion, adduction, internal rotation, and kind of displacement from anterior to the posterior that provide a kind of example for a kind of dislocation for you. This is the position of the patient. After he's coming to the clinic, you see that there is a kind of adduction and internal rotation, and the patient cannot actually move his leg because of the dislocation. And so on, there are different types of the dislocation. I don't want to actually bring it on your mind. Just have a look that this is actually 5 different types of the dislocation you might come from. And we do have another type of the dislocation which is happening at the time of the birth. We call it congenital hip dislocation or congenital dislocation of hip, CDH, congenital dislocation of hip. This is the time that the child, the infant, at the time of delivery, at the time of the birth, does have a kind of rotation of his leg, and the head of the femur is going out from acetabulum fossa. So, any case, these people does have a kind of bad walking, such a kind of limping during the walking, or waddle gait or something. In any case, they may be familiar, be acquainted against this behavior, this actually sign and symptoms of walking. So they can't understand they have a kind of limping. They are not feeling that. But you as a kind of professional person or another third person can easily find that, okay, there is a kind of limping when he is or she is walking or something. We may provide a kind of a screen for these people. As far as we are getting the exact diagnosis, we get a kind of a screen for that. We can get a kind of very immediate and constructive surgery to provide a kind of limitation for the area of the joint so that there is no chance for a kind of distraction or excessive injury for them. But in any case, they need a kind of rehab after surgery or after the splint usage. And we have to provide a kind of balance between the muscles here, the tendons here, and increase kind of coordination in terms of the tendon and muscle working. So in any case, we have to decrease the chance of over excessive movement and a kind of force or compression force on the joint. That is the main key for decreased level of the pain and also bad feeling or walking. So the treatment can be surgery, as I told you. Immobilization is necessary. Any kind of injury you are using, you need a kind of immobilization because you are starting an inflammation session. And in any case, you need a kind of decrease for inflammation. You need to kind of immobilization for the area. And after that, after this period of the immobilization, you need to provide a kind of exercise, rehab. That is a long, different story. You may have it probably next or two term after that. Okay, so this is a picture that shows a kind of posterior dislocation for you, normal alignment, that the hip situation is an even sign, and this is the posterior dislocation. You see that there's a little superior, backward, and internal rotation, and flexion for the knee or hip, something. So what is the problem that you may have during the hip dislocation? Clearly, any kind of the anatomical area with a kind of compression may have a kind of risk of injury. The most important one is sciatica. You know the sciatica can be suffered from L4, L5, S1. So any kind of excessive force on sciatica lead a kind of excessive pain for whole of the lower extremity. And as a result, so you may have a kind of back pain or referral pain or something that is might be necessary to have a kind of mobilization for the area or decompression of the nerve on that area. And the other problem is the vascular injury, which is very popular during the gluteal, the superior gluteal or gluteal maximus. And you see that there is a kind of ecchymosis or very simple actually hemorrhage at the area. It provides a kind of bad feeling, such a kind of tingling in the area, and also ecchymosis and also cyanosis, because it's including some level of very small amount of the bleeding. So in any case, it may need a kind of surgery as well, and it may need not a kind of surgery. That means actually you are using just very simple method of the rehab, such as massage, or probably use a kind of thermal effect, such as kind of hot bath or something, and decrease the chance of the vascular extension or something. So there are some other femoral concepts, such a kind of, for instance, the shortness for some tendon, especially location of the head of the femur at the area of the abduction, internal rotation or something, that lead a kind of bad walking, as I explained it for you. So all of this problem, which I explained it for you, after for a few years, 4 years, 3 years, may lead a kind of, first, change the position of the joint and excessive force on the area, what is happening, excessive force, bring the joint to the level of arthrosis or something. So can we increase the force on the joint, and as a result, you have the chance of the arthrosis. And you know, one of the most important signs of arthrosis is including the pain and lower function or something like that. And so may lead a kind of deterioration or default for vascular circulation, kind of necrosis, because we have a kind of limitation of vascular irrigation, vascular blood circulation. As a result, we may have a kind of irrigation or not enough amount of the arterial blood. That means the level of the oxygen would be decreased, the level of food would be decreased. So it would be reached to a kind of necrosis, death. And the area would be approximately cyanosis. And in the X-ray, you see that the density is not clear. It's not possible to see the bone as a kind of sharp tissue. You see that in a kind of dark situation or something like that. It shows the physiology does not work in appropriate manner. So we call it avascular necrosis. That means necrosis of the head of the femur that is happened because of the no circulation, or avascular, or cut of the circulation or something. Okay, and there is another actually, this kind of avascular necrosis lead kind of excessive force or excessive compression on the area, and finally reach it as a kind of osteoarthritis. Osteoarthritis, the third one. And it would be including the pain, the kind of shortness on somewhere, limitation on the joint, and also cryptation. You do remember the cryptation. Walk in the dried leaf, cryptation. Remember?
Yes.
Okay. And so it leads a kind of a stiffness for the joint for sure, because there is a kind of limitation after a kind of arthrosis or arthros sign and symptoms following for the area, for the joint. And also myxid ossificum, that means because of excessive force, compression force, we do have some parcels, we do have deterioration, arthrosis sign and symptoms on the area. We may have a kind of excessive stimulation for some of the mesenchymal stem cells. So in this case, these mesenchymal stem cells going to the area close to the joint or in the muscle and provide change to bony cell instead of myocell, instead of muscle cell. So in this case, they are providing some level of the bony cells inside of the muscle. So what is happening? The muscle cannot provide excursion very easily, and it will be including the pain as well. So we call it myxid ossificans. That means bone inside of the muscle. It's happened because of force, because of compression, and arthrosis sign and symptoms. Clear? Okay. So we do have another part of the dislocation, which is anterior dislocation. And anterior dislocation is happening with some level of deflection or extension, abduction, and external rotation. So again, it may happen in car accident as well. And so it does not work, I think. It does not work. You remove mine. Okay, go on. We don't have enough time. You see the clinical manifestation right now. And so, most is happening just because of what? Because of the traumatic injury. I didn't bring my charger. I have to buy another one here. And this is not working at all. Just slowly. 2 ants per second. 2 ants. You know the meaning of ants? Murche. 2 ants per second. Whatever you said. 2 ants per second. This is the speed of charger. Just slow. You have to put it for 10 hours to get a kind of energy. This is the first time which I have the experience. I didn't know that it's how much going to be different, the fast charge and the ordinary charge. What might be ordinary charge? Doesn't matter because we are close to that. Probably I can use it tomorrow. So you have to keep it for a while, for a long period to remove it. Because the quality of tissue here is fibrocartilage. And you do remember, cartilage is much difficult connective tissue to be healed. Why? One brave student can answer me. Why cartilage is the weakest, actually, connective tissue for healing? Cartilage. You have 10 seconds. 1, 2, 3, 4, 6, 7, 8, 9, 10. Because the cartilage does not have artery. What's up? Because it does not have the circulation. Because so you need circulation, you need oxygen, you need food. Without the oxygen and food, how can it be healed? Nothing. It's not possible. So you have just some source of the source of the circulation, just superficial area of the cartilage, not inside of the head. Okay. So very easy central hip dislocation. This is the last point of the dislocation. You may come from again in an accident, and there is kind of compression there between the head of the femur and also the bottom of the acetabulum. So there's going to be a kind of destructive force at the area inside of the acetabulum as well. And okay, so we are checking the dislocation. Just want to add you something for you. We do have Mr. Johnson, if you hand here. Okay, we do have the neck of the femur. The neck of the femur is the weakest part of the bone body, skeleton, in terms of the circulation. Why? Because there is just one source of the blood circulation, and this is the femoral artery, circumferential femoral artery around. In case you have a kind of fracture on the neck of the femur, so it does not possible to heal that if your artery did have a kind of damage. So as a result, you don't have chance of the healing at all here. Here in the middle of the neck or the bottom of the head of the femur, not in intertrochanteric. Well, this is intertrochanteric, and it's going to be a starting point for the body. So I'm talking about the neck fracture. In this case, you have not the chance of the healing. Why? Because the destruction of the artery so doesn't let you to have the circulation, the hypoxia, or the oxygen or the food. And you know there is a capsular pattern here. There is capsule, synovial capsule here. And this synovial capsule is rich before the intertrochanteric line. That means the trochanters, greater trochanters here, and the lesser trochanter here, they are out of the capsule. So any kind of the fracture inside of the capsule on the neck of the femur does have the risk of necrosis. I told you avascular necrosis. And when you have avascular necrosis, because you don't have enough circulation, food, oxygen, you are at risk of necrosis of the head of the femur. And after a while, 1 month, 2 months, the surgeon, the orthopedic surgeon, need to remove this part of the body, and they are using a specific type of the prosthesis. We call it more prosthesis. I told you more prosthesis they are using. They are removing this part and add another excessive prosthesis for the area, which is, we call it, in general lay language, we call it the ordinary people they call it something. Makes no difference. Doesn't matter for us because we are not ordinary. This is processed more. Platin, they call the ordinary people in Iran, they call it platin. I put a platin in my leg. This is not meaning, there is no meaning of it. This is a kind of prosthesis, and the name is more prosthesis. And it's, as I explained it to you in the initial 3 session, this is on the quality of 316L. This is a specific type of the alveoli. They use it to put it because the level of occlusion is so low for this type of the alveoli, actually 316. Okay, and so the person can use it for at least 10 to 12 years. And probably we can remove it after that and change it on the time. But because it's happened mostly during the ages of old ages, so probably it doesn't have any other time to need it or something. And the surgery is very difficult, and at the same time there is chance of the emboli, infarction. You know the meaning of emboli? The thrombosis, which is a kind of clot in the vessel, and the emboli is the clot detached from the vein or artery and going up.
Yes.
We call it emboli. And this emboli can go to 4 places. the heart, the lung, the brain, this vicious circle at the bottom of the brain, and also the liver. And any of them leads a kind of infarction. We call it kind of stroke, and the risk of that is death. The patient would be at the risk of the death. Okay, any question? No?
No.
Okay, see how much we can continue.
No, that's
That's what?
take it a lot of.
Take your time.
No, that's
See how much.
Make it